Now we're in the final segment, segment 8, where we're going to talk about overcoming the barriers and give you a summary of the module. Even though there are many barriers, they can be overcome. An example of a successful model is the VA PACT model, which is explained in this video. I am the physician co-director of a Center of Excellence in Primary Care Education that's embedded in a VA PACT model. We teach interprofessional trainees how to collaborate and work together in teams to deliver patient-centered care. I hope you're able to see in this model how wonderful of an experience that it really is, and how you too could really collaborate to make patient care better.
The San Francisco VA Medical Center is home to one of the 5 centers of excellence in primary care education in the VA. The program here addresses the 4 key elements of the centers and of a patient-aligned care team, including patient-centered communication, interprofessional collaboration and teamwork, sustained relationships, and performance improvement.
The Center of Excellence uniquely prepares them to be leaders in providing patient-centered, team-based care.
I have the opportunity to interact with multiple different providers with different levels of experience, and as a trainee, for me, this is incredible. Additionally, it really allows the patient to maximize their visits, which is the goal.
San Francisco's Center of Excellence uses a combination of formal learning activities, such as presentations, case discussions, scenarios, and role plays, workplace learning activities, such as huddles, performance improvement projects, home visits, group clinic, and shared visits, as well as reflective activities, intra- and interprofessional reflection meetings to enhance and streamline patient care and innovation.
In the past, we trained everybody individually in their professional silos. Nurses train nurses, and doctors train doctors, and so forth and so on. But this new model is so exciting because we're all involved.
He's coming into the city tomorrow for an appointment with me, missing a behavioral health appointment today. And
Huddles involve the physician or nurse practitioner primary care provider, registered nurse, licensed vocational nurse, and medical services assistant on the team. These teams are called Patient-Aligned Care Teams, or PACT.
A huddle is a briefing. It's like on a football team, right before the play, the coach, the quarterback gets in the huddle and calls the play.
So there was pushback, I think, at every step of the way. But you test something, it didn't work, you change it a little bit, you tweak it a little bit, you did your mini steps and you got there.
These individuals meet for 15 minutes during the morning to discuss the patients who will be seen that day, any issues that may need to be addressed, and preliminary plans for the day. This brief meeting improves communication and overall clinic flow for the day.
And that's for 11:14 appointment?
Yes.
In an academic PACT setting, medical residents and nurse practitioner student trainees are integrated into the PACT team. These trainees are responsible for a small panel of patients under the direct supervision of a medical attending provider or nurse practitioner attending provider.
From my perspective, the impact that I love to see is the impact on the education of our trainees.
Right off the bat, we chat about the patients that we'll be seeing today, any sort of outstanding issues that we're expecting, or any sort of opportunities for teamwork that will necessarily come up during the day.
These academic PACT programs are unique in that they facilitate learning in real-world experiences in an interprofessional environment, working closely with other trainees and professionals in different disciplines.
I think the biggest thing for me is it's the relationships. I have the opportunity to work as really part of a team. It really breaks down the old hierarchical model.
I think it forces everyone in the community clinics to do a better job of role modeling. And so we've all, psychiatry leadership, medicine leadership, we've kind of had to work together to make sure we're role modeling the correct thing. And that's something that we may not have been as conscious about before there was the COE trainees in place.
I think we have really integrated this flattened hierarchy into the culture of the clinic, where every single discipline, be it a dietitian or a pharmacist or a licensed vocational nurse or a clerical associate, actually has a voice in the care of the patient.
Here, you are treated as part of the team, and your work is valued, and it's felt valued.
Regular team huddles are recommended nationwide as a key element of the patient-centered medical home. Communication is critical for patient safety at the VA.
It really is an immersion experience, and I believe that the best learning and the most meaningful and valuable learning happens through doing whatever you're trying to teach.
It happens here as the busy day begins. This unique organization of staff, trainees, and faculty makes all the difference to patient care.
So I see you have a clinical pharmacist appointment today?
That's right.
That's correct.
With a team that is dedicated to a certain number of patients, then you come in and everybody on that team knows your history. So they know who you are, they could call you by name, and it makes it feel more like, I guess, like home.
The San Francisco VA cares for over 10,000 veterans in our ambulatory clinics that are spread throughout Northern California. We offer patients state-of-the-art care with a patient-centered approach. Our trainees learn key components of the patient-centered medical home model, including quality improvement. Each trainee is expected to be a part of an ambulatory quality improvement project which addresses clinic needs.
What's exciting about this is that it's very innovative. We really are leading the way, and we actually think that we will make an impact on the educational model at a lot of medical schools.
The enhanced understanding of each other's skills and abilities really fosters a collaborative practice.
What we're trying to do is have physicians and nurse practitioners work in a collaborative environment that honors both professions for what they are.
I think there's phenomenal faculty here, but it's also the team-based approach. It's what the RN can bring to the table for this team. It's what the LVN can bring to the table.
He states that his AM sugars have fluctuated greatly. He's unable to really see any kind of triggers.
The San Francisco VA Medical Center is blazing new trails to excellence in patient care education. A true collaboration between clinical practitioners, educators, trainees, and their patients. The Center of Excellence here is a model for healthcare innovation and communication across VHA.
So how will our work get done? First, through effective communication. Remembering not only does it matter what you communicate, it also matters how you communicate. By using strategies that promote collaboration, such as briefs, huddles, and debriefs that give a structure of how to plan and assess the work. And finally, by applying communication tools, IPASS, ISBAR, and checkbacks, and many others to facilitate complete, concise, and clear communication. There are many barriers that make collaboration difficult. We're all different people with different background, training, knowledge, and expertise. But if we overcome the barriers, we will all provide better patient care and enjoy our work more.